Hi everyone. Today we are going to discuss about the topic enema procedure. Enema and its types already I discussed on another video. So today I will discuss about the enema procedure. So what is enema? What is a cleansing enema procedure? And what are the articles need for this enema procedure? And what is the purpose? What are the contraindications if we are going for an enema? So these are the topics we will discuss today. Okay. So definition of enema: introduction of a solution into a large intestine for removing feces and cleansing the bowel. Sometimes enema will use as a medication purpose. At that time we will introduce some medication and it will retain for some time to absorb that medication, or sometime as a nutrition management also we will use enema. So here we will discuss about the cleansing type of enema and its procedure. So what are the purposes? To relieve constipation or fecal impaction, to prevent the involuntary escape of fecal matter during surgical procedure and delivery. So these are some problems. So involuntarily the feces will pass means that table or during the procedure in the surgery time, it will make some problem or it will make infections, chance for more infection. And during an OT table or during surgical procedure, we should maintain an aseptic technique. So if involuntarily these pieces will pass means that will interference or a hindrance to this procedure. And to promote visualization of the intestinal tract during radiographic or instrumentation examination, for example, colonoscopic examination, that time we should remove the feces before itself or prepare the bowel with enema, then only they will go for colonoscopic examination. Otherwise, it will not give a clear picture of the colon. Then to help to establish regular bowel function during a bowel training program. So bowel training program is the management for constipation or long-term constipation or fecal impaction. That time also we will use enema procedure. And preoperative preparation, that all surgical procedure preoperatively we will clear the lower intestine, especially for bowel surgeries. And to relieve retention of urine by reflex stimulation of a bladder. So if urinary retention will be there, feeling of urination will be more, and that is because of one reason is this fecal impaction. That also will stimulate this urine reflex. So we can relieve that reflex stimulation by evacuation of lower intestine. Then some contraindications are there for enema procedure. It include acute renal failure and myocardial infarction, cardiac problems, appendicitis. Obstetrical contraindications include antepartum hemorrhage and leaking membranes. Recent surgical procedures involving lower intestinal or lower GI surgeries, intestinal obstruction, inflammation, and infection of abdomen. These all conditions we will not initiate a enema first. Next, what are the solutions we can use for a enema procedure? Usually hypertonic solution with sodium phosphate we can use, or hypotonic like tap water, and isotonic include a tablespoon of salt with in 500 ml of tap water. That is we will call it as a physiological saline, or otherwise soap and water also we can use, like 3 to 5 ml of concentrated soap solution in 1000 ml of water. These are the major solution or available solution we will use for a cleansing. Then what are the nursing principles behind this enema procedure? First is safety, because we are introducing some medication into the lower intestine and we are removing the fecal matter. So it is very important to make sure the safety of the patient and the environment. Then therapeutic effectiveness. So for what purpose we are doing this procedure? What is the benefit after this enema procedure? So we should mention, or we should be clear cut about the purpose of that procedure, and then should initiate the procedure. Then comfort. We should provide adequate comfort measures or comfort to the patient. Use adequate resources, good workmanship, that is also very important. Should have a thorough practice, then only go for the patient side. Then individuality, patient safety, patient individuality should maintain, because it is like a should provide privacy, everything we should provide, then only we can start the procedure. What are the general instructions for the enema procedure? Which include should be to select an appropriate size of the catheter. That also very important. According to the patient age, weight, and according to the patient size, we should select the catheter size. Rectal tube needs to be smooth and flexible. It should not be a rigid one. Rectal tube is lubricated with a lubricant to avoid injuries. The temperature of the solution need to be adjusted according to the type of enema we are providing. It will vary. Then the amount of solution to be administered depend upon the type of enema. Everything or water cleansing or what is the purpose. Based on that purpose, the solution will change, temperature will change, articles will change, everything will change. The client usually assumes a left lateral position, that is the preferable procedure for this enema. Then the distance to which the tube is inserted depend upon the age and size of the client. The height of the can, how much distance we should maintain within or between the patient and the can, that we should maintain or should be adjust accordingly to regulate the solution or introduction of the solution into the patient. The length of time that the enema solution is retained will depend upon the purpose of enema. How long we should keep or what is the duration of this enema procedure. Everything it will depend upon the purpose of enema. Regulate the flow of fluid according to the type of enema and condition of the enema, condition of the patient. According to the patient condition, disease condition, patient tolerance level, it will vary. If the rectum is impacted with the stool, attempt to remove the fecal first, because if it is an impacted one, whatever we are introducing the solution, it will not come out easily. It will take more time or it may obstruct inside. So that's why we should remove first that impacted stool first, then should introduce the catheter and remove or start enema. Listen to the complaints while we are inserting a tube or catheter, while we are doing this procedure. If any complaints in between patient is telling, we should notice and should manage that first. Then pre-packed enemas will have their own instruction. Nowadays, it is available pre-packed enema solution, small bag type is available. So that all things, it will instructions are already it will be written in over the cover. Then articles needed for an enema. So here enema can and tubing method. Here what are the articles needed? It include disposable gloves, lubricant, bath thermometer, soap and water, toilet tissues, enema can, tubing and clamp, appropriate size rectal tube. For adult it is 22 to 30 French, or child if it is around 12 to 18. That also will vary according to the size or weight of the patient and age. IV stand is needed to keep that can. Then K basin, like a kidney shape basin is available, 2 is needed. Then solution as ordered. What solution is ordered by the doctor, or if any prescription is there, should go through that, then take that solution. Macintosh, underpad and bed pad. These are all the common medical articles needed for enema procedure. So these all articles should be kept ready before starting the procedure. That is very important. Then we can go for the procedure. The first is assess the patient. For all procedure, it is the first assess the patient condition, and last bowel movement, normal bowel pattern, mobility, abdominal pain, everything that all related to this condition for this procedure should confirm with patient and should record it. Determine the level of consciousness and provide privacy. Very important. Explain the procedure purpose to the patient. Then only they will give a cooperation, or they will provide the sufficient cooperation with us. Explain the procedure to the patient. Assemble articles, wash hands and wear gloves. That is our own duty. Raise the bed to appropriate height. That is good body mechanics. We should maintain our good body mechanics to avoid body pain. Assist the patient to sideline position. Provide the sideline. Then place Macintosh under the hip and buttocks and cover the exposing area, only anal area. Only anal area should expose, clearly visualize the anal part. Then only we can see the site of the anal region. Then it will continue, like place the bedpan or commode easily accessible position, then only we can take, and meanwhile we can use that one. Check the temperature of the solution. Once again, already we checked and come to the patient side, still we should again confirm with the temperature of the solution. Raise the container, release the clamp and allow the solution to flow long enough to fill the tubings. That like a drip set we are adjusting, we should adjust the clamp. Clamp the tube, lubricate 6 to 8 centimeter of the tip of the rectal tube jelly. So we should that rectal tip we should lubricate with the solution. Then separate the buttocks and locate the anus. Instruct the patient to relax and breathe or take a deep breath through mouth. Insert the tip to the rectal tube gently by pointing the tip in the direction of the patient umbilicus. Then only it will go inside the rectal area. And here we will check the centimeter or how much distance we should insert. Like for adult it is 7.5 to 10 centimeter. For child 5 to 7.5 centimeter, and for infants it is 2.5 to 3.7 centimeter. And hold the tubings in place with one non-dominant hand. Then open regulatory clamp and allow the solution to enter slowly with the container at the hip level. So this is for according to the enema type it will change for how much or how long we can enter the solutions or how many time it will be there. These all parts will be depend upon the type of enema. Raise the enema can slowly to appropriate level above the anus. Then only the fluid flow will be progress. Then lower the container or clamp tubing for 30 seconds if patients complains of cramping or if fluid escapes around the rectal route. These are times we should stop or should stop for some time. Then we should observe the problem. Then we should continue. Clamp tubing after all solutions installed. Inform the patient that fluid installation is over and the tube will be removed. Once we are completed the procedure, we should inform the patient, then only we should remove it slowly. Place layers of toilet tissues around the anus and gently withdraw the rectal tube. Then explain the procedure to the patient or that all parts to the patients and feeling of distension is normal. All part we should discuss with the patient. Then discard the disposable used items in proper receptacles or waste buckets. If enema can needs to be reused, rinse out thoroughly with soap and water. Assist the patient to toilet and help to position in a bedpan. If the patient is a bedridden patient, we can tell the patient to use a bedpan, or otherwise we can tell the patient to go bathroom and to pass the motion. Then observe the fecal matter and expel the solution. Assist as needed to wash the anal area with soap and water. This is also very important. Remove and discard the gloves and wash hands. Then assess the condition of the patient abdomen may indicate a serious problem, whether abdominal distension is reduced or any other problem, any rectal area and all should observe. Assess the condition of the patient abdomen. Then record the type and volume of enema given and characteristics of the rectum return flow. So how much they passed like that and all, we should record it properly. Report the failure to defecate to the physician. If all enema procedure completed, then we remove the catheter bag. Still the patient is not passing the stool, or if the patient can't complete that patient can't pass the stool or motion, means we should inform to the doctor or physician. Then clean and replace the reusable articles and discard it in the waste bucket. Okay. So this is about the procedure for a cleansing enema or a can type enema. So if it is with a funnel or catheter, the procedure has little changes. Here, a small enema to be expelled are given using funnel and catheter. Small amount we will use this type. And the oil enema is usually used, preferred for this type. And the oil is kept warm by placing the container in a bowl or warm water and then during the administration the height of the funnel should be above or more than 8 inches from the anus. Help the client to retain the solution either by raising the foot and or by pressing the buttocks. Or the oil enema is to be retained 2 to 6 hours to soften the fecal matter. So usually this oil enema we will introduce for 6 hours and it will be softened the stool. After that we should reuse this cleansing type enema to evacuate this content. That is a common procedure. So 2 times we should introduce the funnel or catheter. And it may be then followed by soap and water enema. The preparation, aftercare, and client and articles are same as in the soap and water enema. All other parts will be same. Only the difference is you should introduce the catheter or that funnel part into the rectal area and should introduce the oil with warm water and should maintain the height about around 8 inches and should start with or followed by soap and water enema. That is same as that we already discussed. I hope you got a little idea about the procedure. So this is about soap and water enema or cleansing enema and funnel or catheter type enema.